Hello guys, welcome back to my channel Ages Kingdom. In this class, under neonatal conditions, an important question, several times asked question is respiratory distress syndrome. The word itself is saying the lungs are distressed due to some deficiency. This is also called as HMD, hyaline membrane disease. Respiratory distress syndrome also call it as hyaline membrane disease, and the problem is mostly in alveoli. If you want to speak about alveoli is constricting and relaxing. During inspiration it will be expanded, and during expiration it will be collapsed. These two things are happening because of the surfactant means, you can understand, when you mix a surf in a bucket of water, the bubbles which comes on and tender base on the top of water, it's like causing a surface tension, so that it is helping for the expansion of that bubbles. The same reaction is happening even in the lungs also. Because of that surfactant only, lungs can able to expand and collapse. But in this condition, in the respiratory distress syndrome, the babies who born prematurely, means before complete development of the organs, or before completion of the gestational age, or the baby is already IUGR, intrauterine growth retardation. In all these complicated newborns, definitely respiratory distress syndrome will be there. That is call it as a hyaline membrane disease. And you can see the meaning. Most common cause of respiratory distress syndrome is in preterm babies. Before completion of gestational age, the child is getting delivered, means there is a chances of getting respiratory distress, and due to structural and functional immaturity of the lungs. So, underdeveloped parenchyma or surfactant deficiency or type 2 pneumocytosis. So, in these conditions, usually respiratory distress syndrome can be seen. Because of these, decreased lung compliance and unstable alveoli. Alveoli is not able to expand and collapse. So this can be happened. So in this situation, what we have to do? So we'll see, that's a definition. It's called as a hyaline membrane disease, and usually child born with important these six characteristics. So that's called it as a tachypnea. The respiratory rate is more than 60 per minute, and tachycardia, heart rate is more than 160 per minute. Cyanosis, because lungs are not doing its function of inspiration and expiration, so cyanosis will be there, and the baby will take extra effort to take inspiration. So that's why we can see the nasal flaring can be seen. And grunting you can see in the chest cavity. Apnea or dyspnea can be there, and chest wall recession like suprasternal or intercostal or subcostal, the recessions can be seen. So when we see what are the causes for this respiratory distress syndrome, and it is completely based on gestational age. Healthy newborn baby may not have this problem at all. The babies who born before the term, we call it as a preterm baby. So usually the main causes are in preterm infants only. So that can leads to hyaline membrane disease, pneumonia, asphyxia, and congenital anomalies of or malformations. At term in infants, there is a chances of getting this respiratory distress syndrome due to meconium aspiration. Let's call it as a MAS, meconium aspiration syndrome, pneumonia or transient tachypnea of newborn, acidosis or congenital anomalies. These are the causes for respiratory distress syndrome. And you can see some more other conditions also, like parenchymal conditions, developmental abnormalities, airway obstructions, then mechanical abnormalities. There are different kinds of causes can leads to respiratory distress syndrome. So when you see in neonate respiratory distress syndrome, the major cause for neonatal respiratory distress syndrome is medical. So the medical reasons are preterm babies or term babies. So in the preterm babies, the most problem is surfactant deficiency lung disease. We call it as surfactant deficiency because in the preterm the lungs maturity has not developed properly and the parenchyma has not developed properly. Because of that, surfactant deficiency can be seen, and that's we call it as a respiratory distress. Whereas in term babies, there is a chance of transient tachypnea of newborn baby, TTN, and meconium aspiration syndrome MAS, and neonatal pneumonia. These causes can lead to neonatal respiratory distress syndrome, and sometimes surgical requirement conditions like congenital diaphragmatic hernia or congenital pulmonary airway malformation like TAF, we can say tracheoesophageal fistula, and some other conditions where it is connected to stomach or esophagus because of the aspiration. Those conditions also comes under neonatal respiratory distress only. And systemic or extra thoracic means sometimes this neonatal respiratory distress syndrome can occur due to sepsis or severe anemia or specific congenital or skeletal dysplasia or NES in syndrome. So these are the common causes of neonatal respiratory distress syndrome. So what you have to do when baby comes to the hospital, the first step what you have to do is the respiratory distress is in which condition? Is it a mild, moderate, or severe? So if it is mild, then mild tachypnea is there or grunting is there, what you have to do, and severe tachypnea is there, what you have to do. So if severe tachypnea is there, then immediately you need to do resuscitation. We have to give pulse oximeter and supplementary oxygen and chest radiography. And if after oxygen administration, if clinical improvement is there, then you just observe for 10 to 20 minutes and you can continue the normal routine care. If after pulse oximeter checking and after oxygen administration, after chest x-ray, if it is not improved condition, then immediately we have to shift to NICU, and we need to do endotracheal intubation and ventilation, NICU consultation, and consider antibiotics and consider laboratory tests. These all things need to be done. In case if the child comes to the normal position within 10 to 20 minutes, just then you have to observe normally. It's a resolve spontaneously. Then if yes means just suggests of transient newborn care and routine newborn care we can do. Whereas if still after x-ray and after oxygen administration if it is not respond, then here also we have to follow NICU protocol only. So that is about management of neonatal respiratory distress syndrome. So the major causes already I have discussed, so I am not going to discuss here. So if you want to assess the baby whether baby is in a mild, moderate or severe, you need to use one scale that's called Silverman score. This is repeatedly asked question, 5 marks question. RDS they will ask or Silverman score also they will ask. So this scale is used especially in preterm babies. And when upper chest retractions are there, synchronized means 0, then lag on inspiration means 1, and seesaw like up and down version is there, then that's a 2. Then lower chest retractions none, and in just visible